Oh, it automatically records.
Mhm.
That's interesting. Okay, we'll just wait, I think, a minute for everyone to get in. Okay, I think we'll start. Yeah, I think we'll start now. I'm just gonna quickly introduce the webinar. So, good evening, everyone. Thank you for joining us today for our first trainee pharmacist webinar. I hope you can hear me just fine as well. As you can see, we have two lovely guests joining us, our speakers today. So essentially, this webinar hopefully would be very useful to you, especially since you've just started your foundation training, and essentially it is what you could expect during your foundation training. Um, just to be clear as well, this webinar is an hour long, so we should be finishing about around 9 p.m. And before we start, I'm going to go through a bit of housekeeping as well. So because this is a webinar, your microphone would be muted throughout the session. So that's just to avoid any background noises. It ensures that you can hear your speakers clearly, and hopefully that the session runs smoothly. If you do have any comments or any questions, we do have the Q&A feature. I think the functionality is it's working now as well, so you can always pop in your question. You should be able to find it in the lower bar of your Zoom. So or you can probably find it in more. If you click onto more, you'll find the Q&A icon as well. But yeah, you can always pop in any questions. Hopefully one of our speakers or one of the person in our team would be able to answer it throughout the session as well. But we do have a Q&A session towards the end. So you can also ask your questions there and hopefully we'll help you in answering it. Okay, let me just go to the next slide. There you go. All right, so just to give you a general overview of what this session will cover, we have divided it into 5 key parts, essentially surrounding all aspects of your foundation training. So firstly, we're going to go through an overview of what the GPHC framework is, what the assessment feedback means, how this could be important to you during your training. We introduce you to the e-portfolio as well, giving you all the details, some things you may already know, but some things you may be unclear. So hopefully we'll be able to clarify that as well. Some key important dates during your training, something that you can note down or to remember throughout your training because they could be quite important, especially in relation to your upcoming GPHC assessment. We're also going to provide you with some useful revision tips and advice. So these are tips that you can use throughout your training. But I believe not a lot of us are starting a revision until maybe December, Jan. So obviously, don't worry about it now. We're not urging you to start revision now, but these are just tips you can use once you do start your revision, or just throughout your day-to-day practice as well. And then before we end the session, we're going to do like a very fun sort of a day in the life. So that's where our speakers will speak more about the experience. You can gain insights to what it was like when they did the foundation training because our speakers are we're working in different sectors as well. So it'll be nice to see what it was like, in those sectors. And then we have, like I said, a Q&A towards the end. So if you have any questions, feel free to pop them either in the chat or you can use, like I said, the Q&A feature as well. Okay, so just so you're a bit more familiar with the speakers who's come to join us today. So obviously I'm chairing the webinar today. I'm the graduate officer for BPSA. Unfortunately, one of our speakers was not able to attend today. She had an urgent matter, very last minute, but hopefully she'll be able to join us in future trainee webinars as well. But can we start with Priyanka Patel? If you just introduce yourself shortly, that would be great.
Thanks, Sally. Yep, so I'm Priyanka. I'm a qualified pharmacist now, which still feels a little bit weird to say. But I did my foundation training year in a split GP community. So it was in 6 months in each sector, and I did that in West London.
Lovely. Thank you, Pri. Thank you for joining us today. We also have Deborah as well. Would you be able to introduce yourself?
Of course. Hi, my name is Deborah. I'm also a qualified pharmacist, even though it doesn't feel like it. I've just completed my training year, so I did my training all 12 months in community. I'm based in East London.
Nice, wonderful. Okay, so yeah, you've just been introduced to Pri and Debs. So they will be running through all of the content we have throughout this session today. And before we go to that, I'm just gonna give you a brief overview of what we would expect you to get out of this session, hopefully learn throughout the way as well. So like I said, hopefully you'll understand more about what the GPHC assessment framework actually is, what they consist of, and why it might be important to you. You will hopefully gain a better understanding of what the e-portfolio is, because I know I did not 3 weeks ago, and there are a lot of things that I'm still figuring out myself, but it is a system that is being used throughout foundation training for among most trainees. So it'd be really useful to gain a better understanding of that as well. And like I said, we do have a bit of like a revision tips towards the end, so hopefully that could be helpful throughout your training, and just some techniques that you can implement throughout your day-to-day practice. Okay, wonderful. So we're going to start off with Debs. Would you be able to tell us a bit more about the GPHC framework?
Of course. So you're gonna probably have heard a lot about the GPHC framework, but I just want to take this opportunity to reiterate how important it is to familiarize yourself with the framework. Included in it, it has a breakdown of the different therapeutic areas that you'll be tested on, the weighting of those areas, and the weighted indicative assessment topics as well. It also includes the list of high-risk drugs and the different calculations topics that you'll come across. If you go on to the next slide, I'll talk a bit more of those in detail. So here are the clinical therapeutic areas that you'll be assessed on during your exam. This is across both papers, but mainly in the clinical paper. As you can see, you will already know it. They basically go along the BNF chapters. And yeah, you just have to structure your revision accordingly. So 60 to 70% of your questions will come from the cardiovascular system, nervous system, endocrine system. 25% to 35% will come from this lovely long list here, and the lower weighting topics will make up about 10% of your questions. And those are the smaller chapters of the BNF towards the end, your OTC, most of those things there. The reason why we're saying look at the framework and look at the framework well is because you have to hit the learning outcomes that are set by the GPHC, and within the framework it has next to each learning outcome how highly weighted it is. So essentially the higher weighted ones they are, you'd have to demonstrate your clinical knowledge or your calculations more so. Yeah, that's basically read the framework and know the framework like the back of your hand. It can be really difficult trying to start your revision and structure your revision accordingly, because you're not really given a revision timetable or a list of topics that you have to cover. This along with the sample questions and the feedback that the GPHC gives after each assessment are all the information that you'll be given by the GPHC. So this is like the best information that you can use to go off of, and it's a really helpful way to just start to structure how you go about revising, making your notes, things like that, how you're going to structure your time and everything like that. If you go to the next slide. The framework also contains a list of high-risk drugs or high-risk drug classes, and there'll be at least one question on each high-risk drug or therapeutic class in either assessment. So you need to know them like the back of your hand. This is not just their indications, but their any therapeutic indexes, monitoring requirements, all those things that you would need in a drug monograph, you need to know like the back of your hand for all of them. And calculations. So one thing that I'd say is you'll probably have joined a lot of WhatsApp groups, and people are going to be circulating different, Google Drives and different past papers. The framework has changed. So make sure that you're going off of the topics that are included in this most recent framework. So past papers may still contain questions on things like allegations. You won't be tested on that because it's not on the current framework. So just be mindful and be careful. I'd say start going over the topics that you don't understand as much from now, and then you have more time to, consolidate your learning. As I've mentioned, after each registration assessment, the GPHC provides feedback. And this is for both the summer and November sitting. It's really helpful to go over that because they summarize the topics that as a cohort, students or trainees fell back on and didn't perform very well on. And normally the topics are reoccurring. So when you look through the framework, it's the same kinds of things that trainees are missing during their revision or not being able to demonstrate during the exam. So an example would be, differentiating between red flag symptoms and those that are most likely associated with the illness that can be managed appropriately with the advice of a pharmacist. And another example, so these were taken from our sitting, the June 2023, was that the part 2 tests a wide range of topics and it's not restricted to clinical pharmacy practice. So you can't miss revising your MEP. I'd say start reading your MEP alongside your BNF from the beginning because they can ask such niche questions. But at the end of the day, once you're a pharmacist, you have to know that, and you have to be able to practice safely. So yeah, read through the framework, read through all the feedbacks. If there are topics that are coming up in the feedbacks that you already don't understand, then you already have somewhere to start with. And also do the sample questions. So they don't always release, I think they release the sample questions closer to the assessment, correct me if I'm wrong, but usually that gives an indication of the style in which they're going to write the questions. It's really good to practice those. They say that they'll come up in a similar style in the actual exam. In our exam, I can't necessarily say that the sample questions did come up, but they gave a good indication of what could come up in theory. Yeah. Thank you. And then during this year, even though you've already paid for your training year, you're going to come up with a lot of additional fees. So we just wanted to put this slide in there because we know that as a trainee, we're not making pharmacist money yet. And it can be hard, and these are mandatory fees that you'll have to pay. So just have these figures in mind, and if you can, budget accordingly so that you're not sprung with having to pay £300, £400 at the end of the year. So you will need to pay to sit the exam. You'll also need to pay an application fee. This is towards the end of your training year, so this will be around, I think, March, April time. And then once you've passed your exam, because you will pass your exam, you'll need to pay a first entry fee, which is currently £257, but they may be increasing it. So just be aware of that.
Okay, thank you, Debs. That was really, really helpful. I think you've gone through a lot of the important things that we need to know about with regards to, the GPHC framework, and like that she's highlighted, it is very important that we know exactly what they consist of because these are what we're going to be tested on as well. And I think in a way, like she said, it was structured from high weighting to low weighting. So in a way that would help with the structure of our revision going forward as well. And just seeing what needs to be, what topics we need to go through more and compared to topics that maybe we can do a bit closer to the exam date. Thank you also as well for talking more about the feedback, because I think a lot of trainees don't know about the GPHC feedback and how past assessments, the feedback from past assessments could actually be useful for future assessments, because the GPC do change their structure slightly every year, depending on what that feedback is. So it could be helpful to us for preparation of the exam. Lovely. So on the next section, I think we're going to go more in depth with regards to the e-portfolio. So hopefully, Pri, if you're able to discuss more about that as well, that would be amazing. But let me just switch us to the next slide. Lovely. There you go. All right, Pri.
Perfect. Thanks, Sally. Yeah, so so far we've talked about the exam and revision, and the end goal of the trainee year is, of course, to pass the exam and get on the pharmacist register. But you need to bear in mind that your trainee year is, as it says in the title, a whole year. So you're training throughout, and there's going to be things that you need to learn and demonstrate throughout as well. And that's why you will have supervisors. Now, the EAT portfolio is a way to keep track of what you've been learning and make sure that you can demonstrate the skills as well, because it's one thing to sit in an exam and do the paper and pass that, but at the end of it, when you qualify as a pharmacist, you'll be out in practice and you'll have to be demonstrating these skills and using these skills with real life patients and real life conditions. So the EAT portfolio is essentially a way of your workplace and your supervisors making sure that you can do these things and you can do the whole variety of things. So there's some examples on the screen as well of the sorts of things that you can be assessed in, essentially. And that can be things like practical skills. It can be case-based discussion, because you'll likely need to work in a multidisciplinary team at some point during your practice as well. So it's important to be able to demonstrate all of these qualities. Now, the EAT portfolio is a place where you can kind of bring together the evidence that you have demonstrated all this and you practiced it and you're good at it, you can do it. So if you go to the next slide, please. So with the EAT portfolio, you need to build a whole portfolio of evidence of all of these, and you can do that in different ways. There are suggestions of what assessment tools can be used to actually demonstrate these skills. So for example, you can see in some of them, it says that you can use a case-based discussion or demonstrating a skill, those sorts of things. Now, it's not a hard and fast rule that those are the assessment tools you need to use to demonstrate the activities that you need to complete. And that will be up to you and your workplace and your supervisor as well as to how you manage to demonstrate it. It may also vary slightly depending on what sector you're in. So certain sectors will have certain opportunities to be able to demonstrate skills in a different way. So that's something to bear in mind as well. Have the next slide, please. Thank you. Yeah, so it's important to try and complete at least one assessment activity of each type or each group, and that kind of just shows your supervisor that you're able to do a variety of things and tackle a variety of problems that you can face as a pharmacist as well. But also bearing in mind that if you do one activity, it may cover a whole range of the objectives that you need to hit for your EAT portfolio. So you could have one day where it's just, let's say you work in community, and it's a really busy day and you come across quite a few complex cases or one particular case or one particular patient where you're able to demonstrate quite a few of the skills. So you might have to do a clinical check, let's say take their blood pressure, you might have to demonstrate your ability to work in an MDT. So let's say their blood pressure was really high and you have to communicate it back to the GP or talk it through with the pharmacist, that sort of thing. So it's just one activity, but you've demonstrated a few different skills. And so when you are writing up your evidences, try to keep that in mind and don't limit yourself, because then you'll build a bigger bank of evidences and a more effective evidences as well, because you're able to say, oh, I did these 3 things and demonstrated these 3 things in this one scenario within this one evidence. So try and see all of the different things that you did in it, rather than just say, okay, yeah, I took a blood pressure, so that's the main thing. This evidence hits that box and that's it. Think about what you did around that activity as well and see if you can kind of score some points or hit some points using that as well. Have the next slide, please. Yeah, so in terms of tips for building your e-portfolio, it's important to make sure that you're doing it throughout the year because, as I said, these are things that generally the opportunity comes up organically because a patient walks in, or if you, whether you're in hospital or GP or even industry, whatever sector you're in, something happens during the day that you can't pre-plan. And that is where you find your evidence essentially, and you're able to demonstrate the skills. So that's why it's important to kind of be aware of this throughout the year so that whenever you do come across a day like that, you can note it down and you can record your evidence straight away. Another tip that I'd say as well in that regard is make sure you either have a notebook or somewhere else. For me personally, it really helped to have somewhere else to write it down before you submit it on your e-portfolio, because then you can kind of just gather your thoughts or jot down the main points and you're not able to write out the whole evidence properly at that moment. And then you can come back to it and remind yourself of the specifics and then write it out in a nice way. Um, the other thing is to organize regular meetings with your designated supervisor. So making sure that you're able to talk through things through with them, talk through cases, ask for opportunities as well. If you feel that, oh, it's been X amount of time and I don't feel like I've had the opportunity to demonstrate any of these skills, you can ask and say, is there any consultation coming up or an appointment booked or anything where I can perhaps either shadow or lead or do something so that I can also learn and contribute and also build up my evidence portfolio. So try and be on the lookout for opportunities. And the best way to kind of do that is also having regular meetings and discussions so you can check in with your designated supervisor so you know what they can provide you, but also they know what you need and can keep an eye out for you. And then as you progress further on throughout your training year, you'll see that you're taking on more complex cases or you're coming across more complex patients, but you're actually feeling more comfortable to be able to tackle those. So your evidences and your e-portfolio will demonstrate that growth. And that's what the whole point is essentially, to show that you've gone from a trainee to, by the end of the year, your evidences kind of show that, yeah, you're ready to be a pharmacist and you're ready to go out into practice. Have the next slide, please. Perfect. So that's your e-portfolio. Now, with the e-portfolio, the reason why it's important throughout the year and not right at the end, and not just right at the end, is A, because as I said, opportunities will come up organically, and it's hard to go and rush and try and get all of these evidences done in the last couple of weeks or anything. But also because you'll have regular reviews with your designated supervisor, and you need to be signed off as satisfactory in all of these reviews. The main important one, so you'll have a 13-week review, a 26-week review, and then the 39-week review. Now, the 39-week review is the one where you have to get satisfactory, otherwise you can't sit the exam. So your designated supervisor has to feel that you are ready and you've demonstrated through your e-portfolio, through your day-to-day work, that you are able to sit the exam and become a pharmacist. So that's the most important one, I would say, although of course you do need to get satisfactory throughout to be able to progress to the next stage throughout your training year. Now, depending on whether you're going to be sitting the summer or the autumn assessment, your 39-week review, if you're sitting the summer assessment next year, will generally be around the April mark, depending on when you started. And then if you are sitting the autumn assessment, it will be around September that your 39-week review will roll around. So making sure that you're completely ready to, and your designated supervisor by then is also happy and comfortable enough to sign you off. And that's why, again, regular meetings really help because they're able to see that growth in you throughout the year. Now, if you do need any adjustments in the exam, for example, if you got extra time within your exams, you need to apply for this a lot earlier, actually. And it kind of surprised me during the training year as well to see how early it was, and it was actually before your 39-week review. So if you're sitting the summer assessment, it's in March that you need the deadline for applying for reasonable adjustments. And if you're sitting the autumn assessment, your deadline will be August next year. So again, if you did have any reasonable adjustments throughout your exams in uni, for example, then you may be eligible to have some adjustments with the GPHC exam. they have a lot more information about this on their website and what criteria you need to meet and how you can become eligible, but also you can talk to your designated supervisor for more advice if you want about that as well. And then finally, the big exams, because it's 2 papers. So your summer assessment will always be around the June mark, and then the autumn assessment is generally in November. So those are some important dates for your diary and just things to bear in mind because you can work towards them.
Okay, thank you, Pri. That was very, very helpful. I think you've covered most of everything with regards to ePortfolio, or just the key points that we need to keep in mind anyways. And it's really nice that you gave a lot of advice along the way as well, and just give us some tips on what potentially we need to remember with regards to updating our ePortfolio and why it's so important, and why that discussion with our designated supervisor, having that regularly, is so important. Because like I said, it's great to always check in, because sometimes, you know, starting the foundation training year, you kind of come in with a clean slate and not really understanding what you're stepping into. So obviously going for guidance, seeking guidance, and not being afraid, like you said, to ask for opportunities and to try new things. Because like I said, that's the best way to really learn. It's not essentially getting it right the first time, but doing it again and again and again until you feel more confident, until you feel like you've excelled that particular skills, and especially that you can record them as evidence and potentially upload them into your ePortfolio to show that you're capable of doing this, you're able to carry out this task. But yeah, that's really some really great tips. Some more really great tips as well with regards to revision. Debs will actually be sharing with us. And just to keep in mind, this is not for you to start now if you don't feel that it is necessary to revise now. But obviously, this will come in handy, hopefully, more towards the beginning of next year. So yeah, I'm just gonna bring it to Debs.
Thank you. Just to quickly follow off with what Pri was saying, she mentioned bringing a notebook into work, and honestly, that it's not on the slide, but especially the first couple of weeks, that would be one of the biggest tips that I'd have, because it is so overwhelming the first, I'd say, month or two. You're just trying to figure things out, and it's not the same as when you were on placement and you'd come into the pharmacy or you'd go into the hospital. Like, you're learning, but you do still have a lot of responsibilities, not to the same level as you would be if you're qualified, but it's go from the get-go. And sometimes you'll come across something, you won't be too sure what it is, you'll want to ask about it and you'll forget, and then if you've not written it down, so much happens during the day, you will never get back to it. So get a notebook and either keep it in the pharmacy or take it home with you and then bring it back in each day. Yeah, that's a very, very good tip. And although it is quite early in terms of hardcore studying, our number one tip would be to start early. You have to get through a lot of content, and you have to not just get through and understand to pass an exam. You have to understand to practice safely, and you will also be practicing as a trainee. So from the get-go, just start as early as you can, go through the framework, list the topics as they are. Something I found quite helpful was after each topic, actually going through and writing each therapeutic area. So, you know, listing in respiratory, we've got asthma, we've got COPD, you know, in cardiovascular, arrhythmias, like actually breaking it down, because just, you know, having 4 lines of high weighted topics, that doesn't actually give you an accurate description of what is actually included. Now, this is a bit unconventional for a webinar, but I'm just going to show you. I listed this from a webinar that I had actually joined as I was training, but I don't know if you can see this. This is like my list of the therapeutic areas, and then it broken down, and the same with the calculations. Like, have that listed, and from the get-go you'll be able to see, okay, I do not know the first thing when it comes to the monitoring requirements for sodium valproate. I need to know that, because you will literally be asked the maddest of questions, even if you have you feel like you've gone through everything. My other tip, or our other tip, would be aim to have gone through the BNF and the MEP at least once before January, because realistically this is the time where you should be spending more time learning topics that you're not quite familiar with or you don't quite understand. You don't want to leave that till last minute. You don't want to be trying to learn all these different mechanisms of action 2 months before the exam. That is the time that you should be consolidating your learning. Sorry about my lighting, guys. Another tip would be practice your calculations and start practicing from early, because the thing with calculations is you either know it or you don't. You either know how to work through it or you don't. So if you get exposure to as many different types of calculation questions as you can, then you'll be better prepared for it, because there's only one answer and you're never going to find that. I was a little bit of a nerd. I used to do my calculation questions on my lunch break, because I just quite liked knowing that I've at least done that. I had protected study time at work, so I'd do my normal revision, my clinical, during that protected study time, and then when it was lunchtime, I would sit and do my calculations while watching my anime. And it was really helpful because I then knew what I actually needed to go over more so than what I didn't. Other tip is start doing past papers early. So I started doing about a paper a week in January, and I say a paper a week loosely because some weeks I'd managed to do 2 and then I wasn't able to do another paper in full until about February. So give yourself grace. Don't plan this very, very structured, detailed revision timetable starting from now and then knock yourself down because you're not hitting those targets. Like, be realistic about your time, but if you start early, you will have more time to go over everything. There was something else I wanted to say. It has slipped. I'm gonna give it to Priyanka for a second, see if I can remember.
Yeah, of course. In terms of more tips, so again, with start early, not only are you making your life easier for the actual exam, but again, remember that as a trainee, you're going into a job every single day, right? And you need to be able to demonstrate these skills. So the earlier you start with your revision and the more familiar you are even with your clinical topics, if you're, let's say, again, community example, if you're standing on the counter and someone comes and asks you a question and or shows you a rash or so shows you something, you're more likely to be equipped with the knowledge to be able to answer those. And that will kind of make your day-to-day work life easier as well. And that's not to say that you're going to be responsible from the get-go to be able to have all the answers. You should and will have your pharmacist there as well to be supporting you, but it's always good to give it a go. And also then you can learn and get some feedback, get more detailed feedback from the pharmacist as well afterwards in terms of, okay, you did this well, maybe you need to brush up on this area. And that will help guide your both your revision and your practice as well. So starting early has a lot of benefits. And no matter how small it is, it will contribute in your day to day as well. Des, did you remember or shall I?
That is actually almost exactly what I was going to say. Use every opportunity when you're in the pharmacy or when you're on the ward as a learning opportunity. Even though this is your training year, the consensus around your colleagues and your team and the other staff that are working with you is the fact that you have graduated with a 4-year master's degree from pharmacy. So even though you've not qualified, you should have, in theory, this knowledge and you should be able to apply it. It's just that you need to be supervised to do so and you're not yet competent to do so. So your supervisor or your pharmacist manager, or I'm not really sure what they're called in the hospital, but they will have that faith in you, kind of. Use every opportunity as a learning opportunity, especially if in community. I will talk a lot about community. I'm from community. One thing that I'd definitely say, but it is applicable across all of them, is it's so important to make sure that you do your different reviews at those checkpoints and do them in a timely manner, because otherwise you'll just float by through the year. You won't be 100% sure on the areas that you need to work on, the areas in which you're doing well, the additional work you may need to do outside of work. if you have those and you're having your regular reviews with your pharmacist, then you'll be able to actually see your progress and plan accordingly. You will have you can have an action plan, and those are really helpful, not just for your revision and not just for meeting your learning outcomes, but for your practice, and getting that feedback from your supervisor throughout is really helpful. Yeah, and the main thing is just ask questions. There's no such thing as a stupid question. There's always better to ask than do and then do it all wrong.
Yeah, because your training year, as harsh as it might sound, when you're a pharmacist, you really shouldn't be making mistakes. And of course, everyone does make some mistakes here and there. But when you're a pharmacist, then your registration is on the line, or there's legal matters, and it's the impact of making a mistake is a lot bigger in a sense. And also, a lot of the time when you're a pharmacist, again, depending on what sector you're working on in, but also which actual workplace you're working in, you may be the only pharmacist there. And that can apply regardless of sector. So, for example, I now work in a GP surgery, but I am the only pharmacist. So I am the whole pharmacy team. If there's anything medicines related, it comes to me, and I am newly qualified. So that does mean that the impact of a mistake is a lot bigger when you're actually practicing. Your training year, you may hear this from your supervisors and things as well. That's the year to make the mistakes. That's the year to ask the stupid questions, because once you're qualified, you should know the answers to those. So if you don't take the opportunity during your training year to actually train and get ready, not only for the exam, but also for practice, and build your confidence as well, because you may know a lot of the stuff and be able to write it down, or know it within a book, but actually practicing how to communicate things to a patient, for example, because the way we read it, or if we read something in the BNF, if you read that out loud verbatim to a patient, they would not know what is going on and what you're talking about. So little things like that as well in terms of your practice are really important. So ask your stupid questions and ask everything that you want to during your training year, even if you're just unsure. So there were a lot of times when, as a trainee, I would say, okay, I'm fairly confident in this topic, or I've revised it recently, and I kind of know what the answer is or where to go with this, but I'm going to run it through with a pharmacist or with someone else, or a fellow trainee as well. Actually, help each other if there's more than one trainee, in whichever setting you're in. It's really nice to learn from each other, and you can do that a lot as well. And just run your idea and thought process by someone else as well. And that way you can kind of build up your own personal way of tackling certain problems or certain things that you'll need to do within your practice as well.
It's not on here, but I'd say it's a revision tip, but also just surviving the trainee year tip is stay in close communication and stay in contact with either your friends from uni or people that you meet on your training days, and revise alongside them. So with the BPSA, there was 4 of us that were on exec, and we were all in different sectors, all doing our training year at different places. But we had a group chat amongst the other millions of group chats that, as it got closer to the time, we'd share questions and help each other out with those questions, or share revision resources. And it's really helpful to have those smaller groups that you communicate more frequently in, and then still be a part of the larger groups that you'll get filtered through with a lot of information. Just be careful with the information that you're getting.
Okay, thank you, Debs and Pri. That was honestly amazing. I think you gave some really, really strong tips, and obviously like revision tips as well that I'm sure we'll all take away and really use, because like you said, starting early with your revision, that is key, as well as I think starting early but having that balance where you don't burn out around March, April time as well is pretty good. And then utilizing obviously your evidence-based resources, the BMNF, MEP. I think there's this talk about like, always use the BNF, always look at the BNF, but we do tend to sometimes forget that the MEP exists and that we would be tested on the MEP as well. So using all those recommended resources, practicing calculations, like you said, I do think it's very Debs, you practicing calculations during your lunch break is another thing. But you know what? Just finding the time to carry out this revision, because if Debs can do it, you know, you can do it as well. But it's just mainly finding ways to fit in revision, because I know it is difficult as well doing, literally a full-time job, a 9 to 5, and then expecting to come home and do extra revision on top. I think a lot of people, when they hear that, it's not the most ideal situation, but I think just understanding that this is something that you can slowly integrate into your everyday training, and getting into the habit of it could be very useful as well. But thank you for sharing all those revision tips and other tips and advice as well that I'm sure we could all find very useful, going forward. And hopefully some of us would start integrating that. Oh, Pri, you have something else to say as well.
Yeah, I just remembered as you were talking as well, actually. One thing that I think you should kind of keep track of again from the beginning, and you can be tested on, but is often forgotten in terms of revision, is your MHRA drug safety updates. Now, this is something where that it's really hard to pick up on or learn when you're doing past papers and exams, because as good as they are for building your clinical knowledge and getting familiar with the type of questions, the MHRA drug alerts and the safety updates, they will always be very recent. So any changes to any drugs or monitoring requirements and things that happen throughout your year, you can be tested on and you will be tested on as well. So make sure that you're every so often make it a habit of checking what updates there are from the MHRA and keeping up with the current practice in that way as well.
Yeah, so as Pri mentioned, you can sign up for the MHRA drug safety alerts on their website, and then they come straight to your emails as well. So you can check on the actual website, set it up so it goes straight to your emails. Yeah, and that's not just drug safety updates, that's any medications that have been recalled, like this year. Oh, there was quite a few, so like Volcadine, all those kinds of things, you will be asked of that. Yeah, I just wanted to add that bit.
Thank you, guys. I think, yeah, like you said, that's another excellent resource that we could potentially be tested on, and that could be overlooked as well. So thank you for clarifying that and mentioning that as well. Okay, so moving on, I think this is the part that I'm excited about, because now you guys can share what you did during your foundation training year, and how, so generally just how you found it, what a day in your life looks like, essentially, because I think you both do community as well. Is that right? Yes, both community. Okay, yeah. But then obviously that doesn't mean that you share the same experience, because it does vary between what kind of community, what environment you were in. So it'll be really great for us now to hear what your experience was like, and to just share any advice you have as well with regards to how to basically survive this year, which you have already shared some really great tips, which I'm sure I will take it as well. But yeah, we could start with Pri, if you like.
Yeah, so as I said, I did a split GP community. Now I know, as you said, um, community can differ a lot, and depending on where you are, what team you're working with really matters as well, and how big your branch is, how many items you do, things like that. So to touch briefly on my community side, we're very service oriented. So we have a travel clinic within my community pharmacy as well. So it was really interesting to be able to see that side of things. Um, Another good resource that comes to mind when you're thinking about vaccinations and things, although it's a low weighted topic, is the Green Book, for any vaccination queries, because it is something that you'll need to know regardless of whether you work within a travel clinic or not. It was interesting to see what we do with the travel clinics. We did a lot of, you generally, if you're in community pharmacy, do flu jabs. So there were some days when I went in during October time where I'd go in and I'd be in the consultation room all day, just giving injections. If you're able to be trained as well in your workplace to vaccinate, then that's a really good opportunity, and I definitely take it up. It's really fun, it's really exciting. It also gives you a little bit of confidence in terms of actually demonstrating clinical skills and having those conversations with patients and get into practice as well. So flu jabs was another thing that I think stands out to me from my training year. And then another thing that we to more so towards the end of the year, or I'd say around the middle of the year when we started getting more competent, is we would do all the NMSs within the community pharmacy as trainees. So there were two of us trainees in my community. And NMS, if you're not familiar, is New Medicine Service. So when a patient starts a medicine, they've not had it before, and then you give them a ring, you kind of tell them how to take it and what they need to know about it. And you check in on them, you give them a ring in about a week or two and just see how they're getting on, if they have any side effects and how to help with that, whether you need to escalate it to a GP. So it's really good in terms of learning the drugs quite well and the different classes of drugs as well. So NMS really helped. And it also, of course, builds on your communication. And then on the GP side, so within GP, we would do a lot of prescription management and making sure medication management and making sure that, let's say, the discharge summaries that we received from hospital, all of the medication is changed and is relevant and has been actioned. If there are any changes there, talking to the patients if they're being started on a new medicine. Sometimes within the GP surgery I worked in, the pharmacy team was fairly big, and there were 10 of us trainees, 5 at any given point. And so a lot of the doctors had gotten used to leaving anything drug related up to the pharmacy team. So they'd maybe start a patient on a new drug and then book them in so they can have a call with one of us. And we did this as trainees as well, just to talk through, again, in a similar style to NMS, but just to talk through, you're starting on this medicine, you'll need to come in for a blood test at this point, this is what it means, and answering any queries. These kind of conversations are actually really valuable because they help with the patient's compliance quite a lot. If you understand what you're putting into your body, you're more likely to actually comply and take your medicines and take them correctly as well. So those were the sorts of things we did in the GP. We also did some reviews. So we reviewed medicines. We did some asthma reviews, blood pressure reviews to change. So we had a lot of patients where amlodipine caused ankle swelling. So what would you change them to? And they actually, towards the end of the year again, they left that completely up to us trainees, and we were independently able to make those changes, have those conversations with patients as well. And then the final thing I'll mention for GP surgery is we had, because we worked as such a big team and there was so many people in the pharmacy team itself, so at any given point, as I said, there'd be 5 of us trainee pharmacists. There were trainee technicians, there were doctors, nurses, physiotherapists, prescribing pharmacists, there was an ACP, so an advanced clinical practitioner. So it's really good to be able to not only learn from everyone, because you'll always learn something from everyone. I learned a lot from the pre-reg technicians even. But the other good thing about it is you learn how to communicate or who is most relevant to deal with certain queries, and that will help you when you're in your practice. So no matter, again, where you end up when you're practicing, you'll kind of get an idea of, okay, this patient has this problem, it's going to be most relevant to book them in to see a nurse or a physiotherapist or whoever. So that was another thing from the GP side.
Thank you, Pri. That was really lovely to hear about your experience. It's nice to know as well that you did split, because I think a lot of foundation trainees now, they, the idea of doing a split placement is it's quite ideal, just because you get a taster in 2 different sectors essentially. And it's really nice to hear what you've gained from community and then also what you've learned in your GP placement as well. And I'm sure now that you're working in a GP, those are very useful skills that you can probably use now in your day-to-day practice. So that's really, really lovely to hear. We're also going to hear from Debs as well, because I think, Debs, you did community. So yeah, feel free to share with us about your experience.
Sure. So yeah, I did community. I did a full 12 months in community. I was based in a very busy community pharmacy actually. So we did a lot of items. So my day consisted, first of all, with a lot of dispensing. After I'd had my study hour, I would go straight and be clearing the queue, and the queue was only cleared by about 6:30, and we closed the pharmacy at 7. So there's a lot of dispensing, but I actually found that quite helpful, especially at the beginning, because as you're dispensing, as you'll see, like, whichever system that you're using to dispense, it will highlight those serious, severe interactions. So with your little notebook that you're going to carry with you to the pharmacy, I'd write down the the interactions that I was seeing. And then kind of when I was actually coming across them in my study, I would be like, okay, I remember this patient was on this and this, we had to do this intervention and carry on. So yeah, my day consisted of a lot of dispensing, but we did also run a lot of additional services. So typically we also had a travel clinic, and we'd vaccinate or provide malaria prophylaxis to a number of patients throughout the day. As the trainee, I'd screen it first, so they have to fill out a form. I'd screen and then consult with the pharmacist, and the pharmacist would do the consultation themselves. And I could observe. Towards the end, I was doing it with the pharmacist, but at the beginning, it was more so as observing. We also ran a the hypertension case finding service. It has a really long name, but it's actually quite simple. But it's a very useful service, and it was great for actually working closer in hand with our local surgeries and getting those referrals and referring on patients who were presenting with hypertension. We also had a number of methadone patients, so supervised and unsupervised, depending on the pharmacy that you're based in. Some do have the contract to run this service, others don't. Others have. I remember doing a placement in Brighton once where they had over 50 supervised patients, and that can actually dictate how your day is structured, because when you have that many patients, sometimes you'll have to come in early to pour all those methadones and then supervise those. I would say though, as a trainee, you are not allowed to supervise the patients yourself. It's not safe to do so. You're not qualified. So yeah, just be careful with that. And yeah, I mean, pre and I's days in community pharmacy were very, very similar, I'd say. We did a lot of NMSs. There is also the CPCS referral service. So that is for minor conditions, and it is also for emergency supplies. Correct me if I'm wrong. So we'd have that as well. In my area, we also had a scheme called Pharmacy First. So that was for patients who were from low-income families, to provide them with a free over-the-counter medication for minor ailments. I think that scheme was specific to Hackney. There may be others around. We also did do the emergency hormonal contraception service, and again in my area we had a lot of that. There was additional funding given, so as we got on throughout the year and got more competent and also did the training, I was able to do that alongside my pharmacist. Yeah, it's really hard to actually break down what happens on a day-to-day in a busy pharmacy because it consists of so many different things, but I hope that we've been able to give you a nice overview of things. I think the main thing about community pharmacy is that patients are always coming in, so it's not just having that sit-down consultation in the consultation room or having an intervention over the phone. You will be talking to patients all the time. They're always coming in. And yeah, I also had a counter day, which is not necessarily required as a trainee, but when I discussed with my supervisor, especially at the beginning, I was quite shy. I hadn't actually had a lot of pharmacy experience. So we broke it down that 1 day a week was my designated counter day, and I was at the front, and all the queries, all the distributing the prescriptions, anything that was going through, was funneling through me. But instead of passing it on to the pharmacist, she was right by the window, so she'd be listening to whichever medication I'd be recommending, and that was a really helpful way for me to actually familiarize myself with the OTC drugs, and which are kind of covered in the lower weighting topics. And when I'd have a quiet moment, I'd read the PILs and read all this, because that's the other thing, you need to know the age requirements for these drugs, and they're not necessarily, and the licensing requirements. So that's a really easy way of actually familiarizing yourself and remembering. Just a quick tip. Yeah. So no one day is going to be the same. That's one thing I definitely say. You can't actually, each day is going to be different. You're going to be doing loads of different things, but the key thing is just to reflect on each day. And when you do get stuck, ask and make sure you come back to it. And if you do that from early, there'll be less that you have to figure out again at the end of the year or in the middle of the year than there would be.
Thank you, Debs. That was a really good breakdown, actually, of what you did in community. And it's really nice to know that you both did travel clinic. I don't think I've even had any experience in travel clinic, but the amount of skills that you can gain, like real clinical skills, like vaccination and stuff like that. I think hopefully most of us will be exposed to that. And I think we will have to learn how to vaccinate anyways on one of our regional training days or one of those days coming up. I know it's in my calendar somewhere, but yeah, thank you for sharing all the things that you do. And like you said, the opportunities that you asked for and the experience and knowledge that you gain throughout those opportunities are quite amazing. And it really does build your portfolio. It builds a better, greater understanding of all aspects of pharmacy as well. Despite the fact that it's such a fast-paced environment, maybe that's the aspect that helps with your ability to then absorb all that information and reconsolidate it with it later. Okay, I think we're coming up to, so we're like 4 minutes before the webinar is supposed to end, but just before we do go to Q&A session, I just want to brief you about some of the resources that you can use throughout your training. So like we mentioned, the BNF, MEP, NICE guidelines, NICE EKS, you can use the NHS website. They give a lot of overview of all sorts of conditions. There's also the top 100 drugs. There's also many publications as well that's not mentioned here, but could be applicable to your revision. There's also calculation books that you can use as well. All of these information you probably have already received more knowledge about, or you can go to the RPS website and they do have a list of all the resources that could be useful to you throughout your revision and your training. And then, I think we're ready for any questions. If you guys have any questions, please feel free to pop it into the Q&A box or in the chat, and we'll be here to help you answer them. Yeah.
Just while we wait for the first question to come through, in terms of resources, you should be using good evidence-based resources like the ones that were highlighted on the last slide. But in terms of practicing questions, you can actually pick up quite a lot of things from just practicing a few questions here and there. So there's quite a few Instagram pages that actually help with that, and they'll be just, while you're having your usual scroll through Instagram, you'll see a question, and that way you've done that little tiny bit of revision. There's a lot of resource on the BPSA Instagram page as well, or other social media of the BPSA itself. And there'll be practice questions, so you can kind of test yourself in little bite-sized chunks there as well. So don't feel that you can't use those things to build your clinical knowledge and practice things, but make sure that your actual revision and your knowledge base is coming from evidence-based resources.
Thank you, Preet. I think that's very helpful to know, because there are a lot, like you said, there's a lot of resources out there, some of which, may not be accredited. So it could mislead you potentially as well to your revision. So just make sure you check all the resources that you can use. We do actually have 2 questions at the moment. So hopefully one of our speakers can help us answer them. One of them is, how did you balance your social life with your work life? So if one of you want to quickly share your experiences, there you go.
I don't want to be the bearer of bad news, but I would say that during your training year, your social life is going to either diminish greatly or be virtually non-existent in comparison to as it was at uni. I think one of the reasons that I did take the decision to study on my lunch breaks was so that as much as I could, everything was condensed into those 9 or 10 hours that I was at work. I think it's really important to make time to see people, but at the end of the day, the way I kind of saw it was this is like the final push. This is the last year, and it did mean that I had to let up on some of my other commitments. Obviously, we were on BPSA at the same time, which was in itself a massive time commitment. And it was quite difficult, I'd say, but just kind of staying on top of things, you know, making to-do lists and getting those done early in the week, then I'd know that at the weekend, like, I've done the majority that I need to. Like, I'd make sure not to leave revision until the end of the week. I try and be on it from the beginning of the week, and like be writing my notes for the beginning of the week. And I'd always try and leave Friday, Saturday, Sunday, especially like these early months, unaccounted for, because then when it came to the end of the week, if I was really feeling like a studious person, then I would sit and do a past paper, or I'd sit and reread my notes, or, you know, make some Quizlets and things like that. But if I wasn't feeling up for it, or the week was really long, and you will be tired, that's the other thing. It's not going to be like uni, like you probably already feel it, but when it gets to the end of the week, you're physically and mentally and emotionally exhausted. So I would say structure it so that you're either hitting big topics or difficult topics at the beginning of the week when you have time. Use these first couple of months to figure out when you work well and when you don't work well. So I study really well in the mornings, so I'd wake up early in the morning and study before work, because by the time I came back from work, I was too done. Yeah, I don't know if you want to go.
Yeah, I think you covered it completely.
Thank you, Debs. I'm sure, I think we have time for maybe one more question. But there's two questions that could potentially be answered. Yeah, I was gonna say, so someone did say something with regards to evidence tool being used and just not being sure which evidence tool is used for each competency. Pri, I think if you can answer that as well. And then another question in relation to that is, how many evidences would you need in order to be signed off for each assessment activity? That might have been mentioned previously, but if you can clarify that as well, Pri, thank you.
Yeah, of course. Actually, I think all three of the questions that we have tie into each other. So to start with, what evidence tool to use for each competency? One of the slides that we had did have a good breakdown of some examples that we can have. So it was a colorful one. I don't know if you can get it up, Sally. But if you go onto, if you just type in GPHC ePortfolio trainee pharmacist into Google, it should be the first or second link. It's the HE website, and then you'll be able to see all of the examples. So it was, I think it was the next slide or the one before, the colorful one, where we had the table. Yeah. So for example, on this slide, this is a screenshot taken from that website as well, and it tells you all the possible assessment tools that you can use. With the assessment tools on this table, it does have it in acronym form, but there is, again, on the HE website, a breakdown. And after I've answered the question, I'll put the link of the website into the chat as well, so you can access it there. And then in terms of how many evidences you need to be signed off for each assessment activity, with the portfolio, actually, a lot of it will depend on how your individual supervisor or workplace wants you to do it, because different places will want different things from you. So, for example, I know some of my fellow trainees at different places were told that they need to have at least 2 evidences of each assessment activity. Some wanted 3, some wanted 1 within each period when you're doing between the reviews, so every 13 weeks. So the best thing to do is to have a talk with your designated supervisor and your workplace, so you're both clear from both sides what is expected of you throughout the year. And if they are happy for you to kind of take the lead on it, I'd say having at least a couple for each assessment activity is a good way to go, because it gives you 2 chances to practice something and also get feedback on whatever activity you're practicing, but also it means that you can build a better evidence portfolio. And then just to touch on another question that we have in the Q&A chat about how many, so the question is, how many LNAs do you need to complete in the year and when? So an LNA is a learning needs analysis. So that actually is really useful mostly for yourself. So I know that both Debbie and I talked throughout the webinar about making sure that you know where you need to work harder or where your gaps are in your knowledge. And a learning needs analysis is a nice way to kind of go through some questions and have a reflective period and have a think about where the gaps are or what you need to practice more, where you're not as confident. So I definitely suggest doing one right at the beginning, and generally your supervisor will ask you to do one at the beginning anyway, as part of your portfolio, just so you can see what your baseline at your start is. And then doing a learning needs analysis alongside around about when you're doing your reviews is a good way to structure it as a minimum, because then you'll have one at 13 weeks and you can see in the past 13 weeks, this is how much I've progressed. This is actually where I feel I am now. But also, I didn't even realize that I don't know how to do something, but now I've realized that. So that will be part of your learning needs analysis, and you can see what you need to work on for the next 13 weeks. And that helps break it down into chunks as well, both for yourself and your supervisor.
Thank you, Priya. I think you answered that perfectly. And like you said, all of the questions did tie into each other. Essentially, with regards to the e-portfolio, but I think you really did answer that perfectly. If you do require any more information, like Priya said, it should be in the HEE website, or I think it should be in your VLE as well. So all the documents will be found there. Hopefully, if you've logged into your Moodle, you should be able to find all your documents through there as well. But yeah, I think one of us will hopefully we'll just send it through one of the links or the resources to the group chat. I think Priya is just doing that now, so you can have a better look at that as well. But hopefully you'll get a follow-up email from us as well, and we'll make sure to include those resources for you about the portfolio GPC framework as well. And just one last question, and I think this is the question all of us had in the beginning, because this is what we've been told since the beginning, is that we're supposed to revise the BNF, but that is a very sort of vague advice, I think, because revising the BNF is like revising a whole dictionary, and it does seem very intimidating initially. So I do understand the viewpoint of this question, and I think I've asked that question myself as well. But if one of you would maybe be happy to answer it and just give maybe some tips on how to start revising the BNF, or ways to go about it without overwhelming ourselves, essentially.
Yeah, I'm happy to. So I'll be honest, I found revising for the BNF really, really difficult. I'm very dyslexic, and the BNF is full of tiny, tiny words, and there's so much in there. It was just really daunting. The way I went about it was each week I started in September, and I say started loosely because I wouldn't say that it was always 100% focused revision, but the way in which I did it so that I had at least visited the topics from the get-go. So I revised the BNF whilst also using the clinical knowledge summaries. So if we were to start with gastro, I don't remember what I know. I think, is that chapter 1? I think it's chapter 1. Yeah, chapter 1. I know we just did it, but like I said, I wasn't revising just through the BNF. So I would go through each topic area first, read through the clinical knowledge summary first, make notes, and I'd also highlight. I highlighted, like, if you looked at my BNF now, it makes no sense. And I do it that way. So read the BNF, read the clinical knowledge summary, and then make notes so that it all ties in together, because what you'll notice is there's a lot of duplicated information across NICE guidelines, across clinical knowledge summaries, and within the BNF, but at least when you've actually read it and seen how it's presented on the BNF, like, what to hit and where. And just once you've read it once, you don't have to read it again. Like, reading the BNF isn't the only way to actually study for the exam, but the good thing is it does have everything there. So it's a good way to see what you know, what you don't know, what you know really well, what you have absolutely no idea and can't even remember learning at uni, and then you can use that as like your building block and build from it. I think that's like how I went about, at least with the BNF. I don't know if Priya you'd like to teach on that.
Yeah, so one thing I'd suggest, especially towards the start, is if you're in any trainee group chats, or you have someone who's done the training year and is now qualified within your team, wherever you're working, or even any group chats from uni, which were still useful for me, you may come across, or you can find some BNF chapter summaries, and they're a good way to kind of get yourself started, because it can feel quite overwhelming to have this, as you said, Debs, this fat book with tiny writing and little delicate pages, and it can be quite overwhelming, especially at the beginning. And if you start reading it, I remember I think I opened my BNF and then I started flicking through and I was like, yeah, I don't know any of this, and it just overwhelmed me. So have a look at the if you can find any BNF summaries, chapter summaries, and use that just to kind of familiarize yourself with what sorts of things are going to come up. Now, I wouldn't advise revising purely from those, because depending on who made it and when it was made, it may not be completely accurate or relevant for the exam. And when you're revising from a BNF as well, try and use the most up-to-date copy that you can get your hands on, essentially. Another thing with the BNF is to, at the beginning of each chapter, they have a few pages just kind of talking through that area. So like gastro chapter will talk through gastro drugs. And then as you break down, so you'll have the drugs, and then you'll have the next class of drugs within the chapter. And again, they'll have like a little paragraph. Don't skip over those. They're actually really useful. They're more useful sometimes than going through the drug, because let's say I look at donepezil, it will just say what the doses are, what the different forms are, what the different brands are, etc. All of that sort of information. And that's very nitty gritty. And although it's useful to know, it's not important to memorize, and it's not necessarily going to help you to actually answer exam questions. Whereas if I read the beginning paragraph, which kind of summarizes those sorts of drugs, that class of drugs, then I'll be able to conceptualize what that class does as a whole, if there's a mechanism of action or a way that they all work, or a certain patient group that those kind of drugs are used in. And those sorts of places are a good place to start in terms of building your knowledge up. And then use other resources alongside the BNF as well. So for example, Top 100 Drugs was one that I quite liked because of the way it was laid out. So again, you can go and look at the type of drug, you know that this drug comes up more in practice, or you've looked at all the GPHC documents that they put out, and you can see it's one of the higher risk drugs or one of the high weighted topics. So you can go into your top 100 drugs and familiarize yourself with a few more details than you maybe would for the low weighted topics. And so use your resources alongside each other and kind of build a whole picture rather than focusing specifically. So don't fall into the trap of doing, let me just read through the whole BNF and then I'll read through the whole top 100 drugs and then I'll read through the whole of these resources. You're giving yourself more work if you do it that way. Do it in an integrated way. So instead of saying, okay, in September I'll read through the whole of BNF, or which is crazy, by the way, don't try and do that. But just in general, if you're trying to do all of that in a chunk, instead break it down by topics, because when you learn it by topic, even if a drug or class or something comes up in the exam that you're not as familiar with or haven't gone over as much, if you know what class it belongs to and you know what that class does, or you know anything about that class, you can even make an educated guess. Whereas if you're completely unfamiliar and you've tried to learn every single drug, there's so many drugs in pharmacy, that's never going to work. So that would be my advice in terms of using the BNF.
Yeah, just to echo what Prue said, like your BNF is both your best friend, but also if you don't use it correctly, it can be your mortal enemy. So also don't neglect the first few pages and the last pages in the BNF as well. They have such useful information in there that you will be tested on. So, things like Frailtree, palliative care drugs, pediatric doses of paracetamol and ibuprofen. They may not ask you that, but they always somehow ask you that. Don't neglect your pediatric topics as well. I think that's something I don't think we managed to touch on it, but I think about 10% roughly of your questions throughout both papers will be based on pediatrics. So keep that in mind as you're going through. I think another thing that we haven't mentioned but is worth mentioning, some of the topics they're not necessarily like in line with how content heavy they are. So like we've mentioned gastro, for example, like it's a medium weighted topic, yes, but it's it's got a lot of content within it. So keep that in mind as well when you structure it. Like, it may not be as high weighting, but you may have more that you need to cover. So there may be more that you're not familiar with that you want to go over, and just allow yourself that time as well.
Thank you, guys. I know we run over our time a little bit, but I thought that was such useful advice. I think you answered the questions wonderfully. And that question was answered wonderfully as well. I mean, you gave, like, you know, the real tips and advice. And I think all of us can really take away and learn from it, because as you said, you know, revision does take up a lot of time, and those time are very precious. So you want to make sure that you're revising in a smart way as well. And it's not just a matter of, you know, opening up your BNF and reading through it, but basically planning your revision, structuring your revision, starting with different topics, topics that maybe is relevant to the, you know, clinical case studies that you've seen in practice. That's also a great way to then maybe we consolidate that knowledge as well, coming home and reading up about the drugs that you've seen in practice. So yeah, I think that was really, really well answered. And I think, you know, hopefully all of us would be very appreciative as well, and maybe take away some of that advice. But yeah, I think it's time that we have to bring a webinar to a close. But thank you both so much, and thank you everyone for attending. You guys have been really great asking all your questions, and I really hope you found the session useful. We will be doing more sessions like this in the future. And so, you know, feel free to join us. We'll do more clinical and calculations questions as well, and we'll bring in experts to help you with some questions or case studies. So yeah, just check our website, and hopefully, or we'll update you through our newsletter as well if there is another webinar coming up. Thank you to our speakers today. You guys have you've been so wonderful, and you're bringing so much energy during this session. So I'm pretty sure everyone can feel it through their screen, and you know, hopefully they'll feel a lot more sure about everything regarding the foundation training, the e-portfolio, the revision, the GPHC framework. Hopefully they have a better understanding of what it is, and it isn't so terrifying after all. You know, it is a year, but hopefully we'll all get through it together, and we're not alone. So hopefully you all will receive an email from us as well with the presentation slides from today. And then we also have a recording of the webinar as well. So we will be able to send that through to you as well, and other external resources. But thank you again for attending. And yeah, thank you guys.